Very warm welcome to all of you colleagues. Thank you so much for making the time and joining us, and thank you for your patience as we were getting ready and setting up for this event. My name is Nomtika Mjwana, and I work with Frontline AIDS as the lead for human rights advocacy. And we are very grateful to have this opportunity to be facilitating and holding this space, discussing a really critical issue on ending AIDS for all and the critical role of human rights in a sustainable and equitable human rights response, HIV response. I am happy to be welcoming you, and I want to thank also our incredible co-sponsors who have taken the time to allocate their own time and resources and be able to be here with us and be able to join us today. And a very special thank you to the co-sponsors who have also drafted the resolution, member states that drafted the resolution 56/20 that is informing today's discussion. I also know that we have participants who are joining us online for the session. We would love to welcome you and encourage you to please feel free to engage, ask your questions, share your comments, while noting for both online and in the room that we are discussing a very critical issue at a very critical time. And so it is important that we are mindful and meaningful in how we are engaging. And so whether we are engaging online and whether we are here in person, it is very important to keep this engagement civil, but also keep it meaningful to the point of the conversation and discussion. I am happy to be joined by 3 speakers today who are going to be giving us some insights. The first one is a known familiar face, Christine Stegling, who is the Deputy Executive Director at UNAIDS. Thank you for joining us, Christine. We are also joined online by Keren Dunaway, who works with the International Community of Women Living with HIV as a Global Program Manager. Welcome, Keren. And last but definitely not least, we are joined by Melody Seherrie from Gender Dynamix, who is the Community Engagement, Media Marketing, and Communications Manager. Welcome, Melody, and thank you for having us. So, colleagues, we've got very brief amounts of time, but I do want to encourage that all of us please do engage as soon as our speakers are done with sharing their interventions. We are in a very critical juncture and a period and a time for human rights. We are seeing a lot of decline in resource mobilization. We are seeing a lot of decline in investments, but not only that, we are also seeing an intense and escalating era of conservatism when it comes to global, regional, and some of the national policies. And so with all the commitments that we have made for the SDGs, attaining 2030, the 10-10-10 targets on gender equality and stigma in human rights, the work is questionable, even though we've made a lot of strides and progress. And so I'm happy to share that our colleagues today will be giving us some context on what we are facing at a global scale, what are some of the risks, and what are the responsibilities for us as communities and mandate holders. We are going to be hearing about some of the direct impacts that a lot of what has happened over the years, and it continues and increasingly is happening, is affecting communities in all their diversities. And last but not least, we are also going to be hearing from our colleagues on what it actually takes to make human rights responses work at a community level. What are the examples of what is it that works and the barriers at a local leadership level when it comes to community-led responses for the HIV response? Each year, we are still dealing with over 1 million new infections. We are still seeing over 9 million people not having access to treatment. And in addition to that, we're seeing a lot of social and structural determinants that hinder the progression, particularly for often disenfranchised and vulnerable communities, women, children, LGBTIQ+ people, including sex workers, people who use drugs, and all of the communities that we often serve and work with. Without any waste of time, I am going to start us off with Christine to give us a little bit of a context setting. It's a very dire period that we are facing, that we're in. Could you just give us an overview that we may be missing on what this global context is looking like? what are the mandate holders and communities supposed to be prioritizing, focusing on, looking at? And with all these resolutions and commitments globally that we're making, what are some of the ways in which we can maximize ensuring that we are implementing them meaningfully? Thank you, Christine.
Where do I? Yeah.
I think you're on.
I'm on? Okay.
Yes.
Thank you. Thank you, Chair, and good afternoon, colleagues, friends, and member states here. So thank you, first of all, for everyone for coming today. As has been said before, this is a particularly interesting time for many of us, so we appreciate that Frontline AIDS has taken the time to organize this event. So thank you from UNAIDS to Frontline AIDS. So I was going to start this, my few remarks with saying that we are in a very different space or time as to compare to when the resolution passed last year. But little did I know how different the time actually is and the context is that we're finding ourselves in. And then in some ways, you know, it's not only the difference that we are all experiencing, many of you in the room, where funding is concerned, and funding exactly the kinds of interventions and programs that are so closely connected to this particular resolution and the work that we all hold dear. But we know that what we're experiencing right now really is changing the landscape so drastically that there is a real danger that we could possibly leave millions of people without access to HIV prevention, to testing, and also eventually without treatment, with devastating impact for everybody, for individuals, for communities, for countries, and in particular for community-led services and human rights interventions. And I want to re-emphasize, not because I'm sitting in a room where the majority of people comes from civil society or community groups, but we have been saying this over the last couple of weeks since we have experienced a pause in funding for many of us, including ourselves. But where we see the biggest impact really is at community level, and specifically for services that are targeted and specifically organized around addressing those most marginalized communities. And I want to be very clear about that. I think if we're really thinking about where we're seeing the biggest impact, that's where we're seeing the biggest impact. Then we should also remember that the fundamentals of what is needed for a sustainable HIV response that leaves no one behind have not changed. We know that we need to reach everyone, including the most marginalized, adolescent girls and young women, key populations, and really everybody with life-saving prevention and treatment programs. And we know that to achieve that in a sustainable manner, human rights need to continue to be at the center of our work on HIV and on health in general. I think as we're continuously thinking about, and we're seeing some of these struggles now, that we are seeing a bigger push for integrating HIV services into broader health services. We know that's exactly where we need to be very careful about how a human rights approach is really being is taken care of, because of the particular needs that we all know so well about of populations that might not use mainstream health services. We know that biomedical services are more effective when there is an enabling environment. And I think maybe we're not helping ourselves sometimes when we just say enabling environment. It is around laws that support people, that don't discriminate, that enable people to use services. It is about reducing stigma and discrimination. It's about reducing harmful social norms, including in relation to gender equality. And we know that people will continue to avoid stigmatizing or discriminatory service providers and will go to those that are accepting and supportive. So if we don't have those that are accepting and supportive, we are losing people in the system. We know that work done to reduce discrimination as a central component to the HIV response has been effective, and that rates of stigma and discrimination in HIV service settings are half of that than in non-HIV healthcare settings. And that shows a lot about what we have achieved in the last 25 years to create those services. We also know that significant work needs to be done if we're to make sure that all HIV life-saving prevention and treatment services are non-stigmatizing in increasingly resource-constrained environments. And those are the environments that we're currently facing, right? Where we would have not said that maybe a month ago, we now know that we are facing a lot of contexts with real resource constraints. And we also know that the strong community-led organizations and community-led systems and services are not only essential to the HIV response, they have also an impact beyond, well beyond. We have seen this during COVID. Community-led organizations and services functioned quickly and effectively in reaching those most in need, where other services did not. So if we want a resilient health sector that is ready for the next pandemic, investing in communities and rights is the right thing to do. We all know that. And yet, quite often, these are the elements to go first. And indeed, as we have all observed, they already are going. Community-led services are closing across the world. Reports are coming in of increasing stigma and discrimination and gender-based violence. We've taken a lot of effort at UNAIDS to monitor what's happening at country level. We have built a platform where we're monitoring that. If you're interested, you can see it on our website. And so we're looking at which services are closing, which populations are not being served, and what the challenges are, especially from a community perspective, but often also from a government perspective, who want to do the right things, but don't have the resources now to do so. So those are the achievements that we have hard fought for over the last 40 years, and those are the achievements that are currently at risk. Last year, I think you have already said it, we reported that between 2010 and 2023, annual numbers of new HIV infections had increased by almost 40%, AIDS-related death had halved, and over 30 million people were on treatment. That does though mean that 10 million people, around 10 million people are still not on treatment. We should never forget that. And we also know that with the current funding reductions, we will see at least 6.7 million additional AIDS-related deaths and an additional almost 9 million new infections and 3.4 million children orphaned by AIDS by 2029. So this is modeling we have done if we are seeing the current funding situation not being changed, and if we are staying at what we are experiencing now, this is what we're going to see in the next 4 years. That is what we should actually call a new AIDS emergency. Over 40% of all HIV funding globally is international funding. And as you all know, over 70% of that of the whole global response is funded by the United States government, or was until recently. In low-income countries, 75% of funding for the HIV response is from international donors. In 4 regions, more than 50% of funding for societal enablers comes from international donors, with countries losing some or all funding for human rights work. And in some countries, more than 90% of human rights funding for HIV is from international sources. So that gives us a clear indication of where we're heading at the moment. So the need to find sustainable approaches for the HIV response is more urgent now than ever, especially given the current context. But it cannot be biomedical or financial sustainability only. We need human rights and community at the center if we are to reach all communities, particularly key populations, adolescent girls and young women. And for that, we need political commitment, funding, and action. To that end, I hope to see you all tomorrow at the Council panel discussion on realizing human rights to sustain and increase the gains made in the HIV response and leaving no one behind, which is in room 20 at 2:30. Let me just close with 2 additional reflections. One is what we're talking about is finding strategies and initiatives to increase domestic funding for these responses, right? And what we're observing is that it is easier to find domestic funding in many countries for treatment programs, maybe for testing programs, but not necessarily for community programs and for human rights programs. So this is where our struggle will be and where we will have to come together and think collectively. And let me reassure you that as UNAIDS, we were founded 30 years ago or so, specifically because there was a need for a program to address human rights and put communities at the center of a multi-sectoral approach. And that is still as true today, whether we have less resources, less political will, but that is still as true today as it was 30 years ago. And I think I want to reassure those of you who are worried that UNAIDS will continue to stand for exactly those principles and values, and we will do our level best to continue having those discussions and creating the political will to support a human rights-based approach and to support communities. And I end with that. Thank you.
Thank you very much, Christine. Firstly, appreciating also the work and efforts of UNAIDS, and very thankful to hear that the work will continue as we continue the fight. And I think one of the key things as well that we have to really think through and consider based on what you've reflected on is the readiness of really amplifying efforts for integration and having enabling environments for that, and naming, as you said, what those enabling environments are. So addressing stigma and discrimination and having supportive environments, particularly for people who often experience the opposite. So now I'm going to pass this over to you, Keren, in the interest of time, with some of the reflections that Christine has shared. Firstly, also thank you so much for making the time and joining us virtually, given the challenges with travel, which also have to do with how we are all being impacted. Thank you for being with us. Could you also just share how these current challenges, you work with communities of people living with HIV, particularly women and girls in all their diversities. So how has the current challenges, the landscape, or generally throughout these years, how has these been exacerbated for women living with HIV in all their diversities, and what risks do we face in light of all the what Christine has mentioned now in terms of what we are facing as a threat should we continue in this climate and in this mess, in this climate and nature. It is a mess. It is. It's a concerning mess. And so what challenges do we face with all these regressions, and with the work that ICW does, what lessons as well have you learned? Over to you.
Well, thank you, Nomtika, and hi, everyone. Good morning, good morning in this side of the world, and good afternoon to everyone there. And thank you to Frontline AIDS for the invitation to be part of this panel. And I think the discussion could be more timely. And as Christine said, we are witnessing the progress we've made over the last 40 years in the response to an AIDS. It's slipping away in real time as we're speaking right now. And not because we don't have the knowledge, not because we lack the tools, the activism, or the will, but because of harmful ideologies and brutal political motivated decisions that do not value human rights. Before the current crisis, women living with HIV faced barriers to achieving the rights to health, and especially around our sexual and reproductive rights due to stigma and discrimination. Back in 2024, we actually, ICW, released the first ever global scan of coercive practices, and we analyzed the data from nearly 25,000 women living with HIV of 60 countries using the findings from the Stigma Index 2.0. And the report identified persistent practices of mistreatment, of abuse, and this includes coercive practices. We saw women were being denied services, they were pressured into sterilization or pressured to a specific infant feeding method, and many other violations of bodily autonomy. And this also includes being told that they shouldn't have kids at all. In every single country where the stigma index was conducted and analyzed, women reported coercion, women reported mistreatment and abuse while seeking reproductive health care. And these are not isolated incidents. We have seen and we have stressed that this is a systemic problem. Now this year, ICW conducted a rapid assessment to take a closer look at how the funding freeze has impacted women, especially women living with HIV. And first, I just want to acknowledge and thank all of the ICW networks and women's organizations, including Frontline AIDS, that came together to document the impacts of this freeze, which unfortunately has seemingly been made permanent in the past few days. We translated the questionnaire into 5 languages, and we received 330 responses from 44 countries across Africa, Asia Pacific, the Americas, the ICA region, and the MENA region. We actually are keeping the survey open to continue to create a space for women to share their experiences as well. We have seen that despite public proclamations, maternal health and prevention of vertical programs are not as protected as claimed. And while there has been some official exemptions, many contracts have now been terminated and clinics are shut down. And even just a month into this crisis, pregnant women were reporting that they couldn't get the service and the care that they needed. Even some were forced to give birth at home because clinics had just shut down. And nearly 30% of women who were recent mothers said they couldn't find formula for their babies. And these are new mothers already navigating the challenges of motherhood with HIV, now struggling just to feed their infants. We also saw that women living with HIV are losing access to treatment. More than 20% of respondents reported major disruptions. These also includes clinic closures, medication stockouts, or just being turned away altogether at the clinics. And this is not just limited to ART, but also critical drugs like Septrin. We know that the funding crisis is hitting the most vulnerable first, hitting women living with HIV and women for key populations. This include sex workers, women who use drugs, and trans women, because we are experiencing severe disruption in services, disruption in treatment, disruption in reproductive and mental health care, and disruption in gender-based violence response programs. And acknowledging that many women living with HIV are often working as healthcare providers in our response, another critical thing that we assessed was the mental and emotional toll of what has happened. We saw that women are scared for themselves and are scared for their children. They don't know what happens next, and that uncertainty and that stress is increasing every day. And another thing that perhaps is the most alarming that we saw is the potential rise in violence against women and girls, particularly those living with HIV. And we are seeing some of it already. And when I say rise in violence, I mean violence in every way, shape, or form. Over a third of the women in our survey said that they feared increased violence and discrimination because either financial stress or loss of services. Becoming economically dependent makes them also more vulnerable. And we have already seen this played out, and not just in our assessment, but in the other reports from networks that have been launched, assessing also this risk. We as ICW, we have advocated the importance of investing in women and in women-led organizations, and that in organizations that are by and for women, that have supported and held up entire communities. And over 14% of the women surveyed said already lost their income because of the funding cuts. And this crisis is just increasing and widening the gender inequalities. Women with HIV are not just patients. We are caregivers, we are workers, we are activists, but our needs are still being sidelined. And when funding disappears, women's rights and safety are one of the first casualties, especially now that with the rise of anti-gender and anti-reproductive movements, that is a deadly trend and will most likely continue. And just a brief reminder that this survey and all the information that we assessed was conducted while the funding review was still ongoing. And since last week, with all the terminations, those numbers have only gone up. And some of these essential organizations might not even survive within the next few months. The hardest part, and I think the hardest part of all of this is knowing that this is not just an unfortunate consequence of funding decisions. It's a deliberate choice. It's a broader rollback of reproductive rights, of gender equality, and attack on community advocacy. The reinstatement of the global gag rule, the restrictions on sexual and reproductive health fundings, these are all part of a bigger push to control women's bodies and our lives. We have seen this playing out not just in funding cuts, but in the way that stigma and discrimination continues to shape access to healthcare. And we have been stressing this since the past months, and we will continue to stress this, that key populations and women from key populations are facing heightened risk, and the services meant to protect them are and will disappear. So where do we go from here? I really wish I could say and tell you that there's a clear answer, that there's a clear path. But the truth is that we are in a really unprecedented times, and I want to highlight, underline, emphasize the unprecedented here. We know that the funding was shrinking, but we didn't expect it to disappear overnight. But one thing is clear, is that we collectively are figuring out how to navigate this crisis together as communities, as networks, as activists. And we must ensure that we don't just take or undertake business as usual. And that means to make sure that we know that realizing the right to health for people with HIV also means putting women at the center and ensuring and protective the sexual and reproductive rights, including bodily autonomy. To make sure for HIV treatment requires community and peer support. And without addressing stigma and discrimination, healthcare interventions will fail. But also, we must ensure that our response to this crisis must also be gender transformative. And for now, and I think I'm going to close here, my first message is to governments and donors. Just revisit your commitments to human rights and support of communities. We need you now more than ever, especially when it comes to funding organizations by and for women living with HIV. We need to ensure these organizations don't shut down, don't close or disappear, that they continue to document and monitor what's happening, and that they provide life-saving services. And also, one other thing, and Christy said it, we also need legal protections, real enforceable protections to make sure women, key populations, and marginalized communities can access healthcare without fear, without stigma, without violence, but above everything, can access healthcare with dignity. And our report just underscored the urgent need for a funding model that prioritizes women's leadership, a sustainable financing, and a rights-based approach to HIV care. And sorry if I took more time than I should, but thank you.
Thank you very much, Keren. That is totally fine. I very much appreciate the comment on having a gender transformative and essentially an overall inclusive response in order to provide these life-saving services, which women, girls, and all communities should also access with dignity. I also, the issue of HIV as a reproductive justice issue is another thing that stood out for me as you were reflecting. understanding issues of bodily integrity and autonomy, particularly for women and people who are to have children, and especially the concerning fact of getting to a point where in this time and in this day, in this year and period, people are still being told when and how and whether or not to have children. And so all of those key considerations also have us think about bodily integrity and autonomy overall from an intersectional perspective. And that does speak to policies. It does speak to all the anti-LGBTIQ plus and other criminalizing policies and laws that we have been seeing emerging. So Melody, I'm going to pass it to you, because you and with Gender Dynamics, you have been leading a lot of incredible advocacy work, especially when it comes to human rights responses. So working with this diverse constituency of gender activists and community members, you've led a lot of community-driven and community-led interventions that focus on human rights responses, human rights violations, particularly for disenfranchised communities, including people living with HIV. And so really, for us, it's to understand what is it at this moment and in this time, what is it that you have learned that works with community-led responses? What are some of the gaps that we have been seeing and we are seeing more of now, or we are seeing exacerbated now, and where should our investments be directed to in order to strengthen this response? Over to you.
Good afternoon, Nomtika and fellow panelists. I would like to thank the organizers of the event for the inclusion of community voices and inviting Gender Dynamics to participate on the panel. I think for Gender Dynamics, community-led approaches empowers local communities to take ownership of these type of responses to HIV and AIDS and human rights violations, thus by fostering a sense of responsibility and engagement. So Gender Dynamics values partnerships and mutual participation to the effect where we have collaborated with 5 transgender-led organizations within South Africa. This, as we believe that community-led organizations have a deeper understanding of the local context, including the cultural, socio-economic, and geopolitical factors that impact the transgender and gender-diverse community, as well as the HIV transmission and treatment. Community-based organizations are known, credible, and trusted, and easier to resonate with. So these approaches have and are developing innovative and adaptive solutions tailored to the local needs and universal needs by leveraging community resources within its great limitations and collaborations to foster growth and inclusion. Furthermore, the participative approach to community-led responses amplify community voices to ensure that the needs and concerns of local communities are heard, documented, and addressed at micro, meso, macro, and meta levels of society. Our community-led approaches also provide emotional support, guidance, and encouragement to migrant and asylum seekers, transgender and gender-diverse persons, unemployed, informally housed, sex workers, living with HIV, living with disabilities, using injectable drugs that are or have been incarcerated and currently face societal backlash and political opposition. These individual key populations can intersect at different points or all at once. I think within the South African context, gaps include intersectional frameworks that provide holistic care packages for key populations, and also the government's interest and urgent interventions to address financial and policy gaps that ultimately negatively affect intersecting key populations. In access to gender-affirming healthcare, HIV testing, treatment, prevention, and adherence services. So what the recent USAID PEPFAR funding cuts, we have seen approximately 10,000 trans and gender diverse persons be exposed to further violence and also in access to gender-affirming healthcare services, including HIV/AIDS services, both prevention and treatment. I think what is needed is open and continued communication between civil society organizations at local, provincial, and national levels within our governments. And yeah, and I think we are often, as civil society, we are often mistaken for the mean girls, while our role is basically to assist government in doing better and providing these needed services for our different communities. equitable access to healthcare services and facilities free from discrimination, secondary victimization, and the denial of access to services by the hands of healthcare professionals and support staff. Adequate mental health support is something that urgently also needs resourcing. And especially with the dwindling financial resources, vital key interventions like community-based education and awareness-raising campaigns aimed at addressing HIV transmission, adherence, stigma, discrimination, and violence are amongst the first activities or interventions to be cut short, as Christina's also mentioned. Community organizations often lack access to capacity building opportunities, including trainings, technical assistance, and funding to provide comprehensive services for trans and gender diverse persons and other key populations alike. For the trans community, the provision of gender-affirming healthcare, HIV testing, treatment, and preventative services, as well as mental health support. Resourcing and capacity building for community-led organizations to champion progressive system-level changes is vital and it's needed within our context and many other contexts within South Africa and beyond. The training of healthcare providers on transgender specific needs and related key populations, as well as enabling advocacy for policy redress and change that address the different needs of our intersecting key population. And before I close, I just have one question. Should the graveyards first fill up before we take action? Because it's like everybody's waiting to see, let this thing play out. Let's see how far it goes. But should we first wait and see how many people die before we actually see that this is an emergency? Thank you.
Thank you very, very much, Melody. And I'm sure that a lot of us in the room echo very much that question, because we are in a very intense global space and crisis, and the sense of urgency seems to only be felt at certain spaces and by particular people. So not only are we not mean girls as civil society, but we also do not live single issue lives, right? So when we talk about access to HIV prevention and treatment services, when we talk about integration, the language of, as we had reflected with Keren, reproductive justice, but also gender affirming healthcare is part of really moving and working towards a sustainable HIV response. We do not have a whole lot of time, colleagues, but I would very much like to hear from the floor. Very, very much thank you to our speakers and panelists. But if we have any reflections on the floor regarding this conversation and how we can have a human rights centered and intersectional approach to sustain the HIV response, we would appreciate any questions for the panelists or comments and reflections in the session. Over to the floor. Portugal.
Good afternoon, colleagues. First of all, thank you so much to the panelists and to Frontline AIDS for organizing this important event. And it's crucial that we are here having this opportunity to discuss civil society and community engagement on this topic, especially this week that HIV will be in the agenda of the Human Rights Council. So I think that it's very good that we create synergies to have these reflections. And I would just like to, well, again, reaffirm the commitment of Portugal as one of the members of the core group of the Brazilian-led resolution on HIV and human rights. And just to briefly mention, as some of you might know, the Portuguese experience has been quite successful on HIV, and it has been quite based on human rights and a human rights approach. And it's very much connected as well with our programs in regard to drug policy. And we know that I'm just mentioning this because this is very much connected with the work of community-led services in both cases, and for people who use drugs in that context as one of the identified key population groups. So this is just to highlight that indeed our national experience has shown that the engagement of civil society and community-led services have been crucial for persons with HIV from the different key population groups. And in that sense, we will continue supporting civil society at national level, and here in our external action and foreign policy, we're always open to hear from NGOs that reach out to us and to engage in discussions like the one we're having here today. Thank you.
Great. Thank you so much for your reflections, and thank you for the incredible work and the co-sponsorship and with all the amazing work of the core group. Do we have another reflection, comment? Paddy.
Is this working? Can everyone hear me okay? Sorry, you'll have to forgive me, Christine, because I was just working on some technical issues at the start, so I might have missed it if you covered it. But I just wanted to check if you thought there might be any change to the language or the approach to the 2030 goals.
Another comment online as well, just checking. Okay, Christine, we'll hand this one over to you. Do we need to change approaches? Do we need to consider adapting language and approaches towards 2030?
So I think at the moment, it is helpful to us to keep the goals that we have for 2030. Those are goals that the international community has agreed to, that member states have signed up to. And we use them as the guiding principle for our own global targets for HIV. And we're in the process of finalizing the new targets. As you know, we are going to, despite all the difficulties that we find ourselves in, we still see an opportunity to create the new strategy that would go from 2026 to 2031. And so it kind of goes across the 2030 deadline, right? But it's an important global strategy for all of us to motivate and create a vision for the world to say, look, we know we can do it. We can reach the 2030 goals for HIV. But we can only do that with the right kind of interventions in place. So I think it would not be a good idea to try and change any of that. Obviously, that's also highly complex, but I think it's something that the world has agreed to. So it's a good accountability mechanism for all of us to hold the world accountable, to say, we agreed to this and we can do it, and we have shown that we can do it. But we're now in a situation where that progress is under severe threat. So I don't expect that. I think what we should say, though, in this room, and I'm really grateful to Portugal, to Thailand, to Brazil, who have led on this particular resolution, and we're counting on you and on all the others, not only part of the core group, but other member states that have been so committed to reaching those goals. And in our own context, there's the joint program on HIV, and it's going to be an interesting context in which we are setting this new global strategy. But we do know that we have committed member states who want to make that happen and who want to stick to that commitment, and we're relying on you to make that happen, because we shouldn't forget that this is probably the last time as the global AIDS response that we have that opportunity to create such a global strategy, to create space for a high-level political declaration and a high-level meeting in June next year, where we can get the international community to agree or recommit to those SDG commitments. So for now, my hope is still up that we can continue using that as our guiding principle, but I see the dangers on the road. And I want to, Melody, I think your question is a good one, right? When are we actually going to call this an emergency? Do we have to wait for people to die and count those people? we know that the biggest emergency we're having right now, from my perspective, is already the disruption, not only of treatment, I think more or less, and I hear Keren and I hear the figures that are coming out, but I think in the bigger picture, we have a better success at the moment with keeping people on treatment, but initiating new people on treatment and prevention is going to be our big challenge, right? And that impact we won't see immediately. We will see it in 6 months, in a year's time, when we count the new infections. And I think that is when we're going to have maybe more of an impetus to really call it an emergency. But I agree with you. I think we don't need to wait for that. We have to collectively think about what we do before then.
Thank you very much, Christine. Victoria, I think you have a comment.
Thank you. I hope you hear me well. I'm representing Alliance for Public Health, Ukraine. Dear panelists, thank you for really meaningful and important key messages towards human rights related and humane approaches to prevention and treatment of HIV. As I'm coming from the region, Eastern Europe and Central Asia, which is the region with fastest growing epidemics in the world, I would like to emphasize the importance of supporting communities within this alarming situation when we see that states are imposing limitations for civil society and communities. And we saw foreign agent laws, anti-LGBT laws applied, and very often it is sponsored by Russia, which has the biggest epidemics in the region, and the approaches they use are not those which correspond to human rights approaches. So it's important to support the communities in the countries which are now under huge pressure of governments and under legislative limitations to key communities. Thank you.
Thank you very much, Victoria. I'm aware that Olya has her hand up online. Olya, please go ahead.
Thank you very much, colleagues. Hear me. Thank you for this panel and presenters, particularly Keren, for sharing all the stories from women. And thank you for this panel. It really brings us together and helps us to keep energy going forward. I have a question for Christine. Thank you for ensuring that UNAIDS continues its leadership in the key areas such as human rights and community responses. My question is on whether you have any guidance in relation to engagement with governments on financing human rights and community responses in the current environment. We look forward to continue with UNAIDS Sustainability Roadmaps initiative, which has taken some concrete steps in terms of having dialogues with governments on taking the financing forward. But if you have any reflections or suggestions based on your engagements with the governments, particularly those that are willing to take the financing forward, how to carve out space for human rights and community responses. And lastly, I just want to thank Portugal for their commitment to drug policy and reducing stigma among people who use drugs. Thank you.
Thank you, Olya. We've got 2 minutes. Oh, we've got 2 minutes left. Christine, you have 30 seconds.
Yeah, in my 2 minutes, I also want to say, I think I didn't see, and I still can't see, but I have been told that Colombia is also in the room, who is also a member of the core group. So I want to not miss out on thanking Colombia as well. Thanks for the question, Olya. This is going to be where we can collectively make the biggest impact if we are trying to include or emphasize and focus in this work that UNAIDS together with PEPFAR and the Global Fund has started doing, and the Gates Foundation has started doing, on how we create a sustainable domestic response. And while we see a lot of countries, really quite a lot of enthusiasm, now a little bit more spurred on because of necessity, but initially there was a lot of enthusiasm with many countries. It's about 30 countries who are working with us, because countries want to figure out how they will increase their domestic resources for the AIDS response. And we shouldn't forget that about 60% of all funding in most countries globally comes from countries themselves. So while we often focus on the gap in the international, or the gap that is created by this over-reliance on international resources, there is goodwill and there is political will in many countries. But the tricky point is going to be, how are we creating, how are we engaging with governments to figure out better systems that we usually refer to as social contracting, to contract community groups and civil society, how to sustain the community health systems that we have built over the last 30 years. And I don't have an ideal answer for you, Olya, other than to say that that work exists. We're very committed to continue doing it. We've fast-tracked some of the tools that we developed for this work with governments, and we have started going to governments, some of them are in the room, that have actually best practices for working with civil society, and how they can bring that experience into that space to learn from each other and to see how we can do this better. It is going to be a tough call. I think we know that when there's less resources, the eyes will, or the focus will immediately go to some of the services that are immediately life-saving. And we know that we will have to create a narrative that ensures that people look at the long-term and the long-term viability of the services that will be, and we know that these will partly be in communities. But it's a good question, and I think there's a good opportunity to do that work together with the partners that I've already named.
Thank you very much, Christine. Thank you all, colleagues. We are out of time. I will quickly tie us up by just highlighting key points that have come out, including the fact that we have the knowledge, we have the information, we need to advocate for stronger political will, supporting and amplifying the work of champions from member states to communities who are already leading in ensuring that human rights are at the center of the HIV response, really strengthening how we recommit and emphasize our commitment to ending AIDS in 2030 to the SDGs, adapting relevant approaches with time, and also letting community champions be at the center of leading. And also, lastly, advocating and strengthening government systems for domestic financing and strengthening community health systems as well. Thank you so much, colleagues. We look forward to seeing you all at the high-level panel tomorrow, as this is a very crucial conversation and discussion. Have a lovely day.